Hello everyone, my name is Bharat Bhushan. In this video, I am going to brief about BLS or Basic Life Support for adult victims. Now, as we all know that BLS it's a level of medical care used for victims in case of trauma or medical conditions, any life-threatening whether illness or injury. Under BLS, we perform a technique called CPR, that is cardiopulmonary resuscitation. Cardio means heart, pulmonary means lungs, and resuscitation means to restart or to revive. Three conditions. The patient should be unconscious with no normal breathing and with no carotid pulse. If these three conditions are present in the patient, that means we have to immediately start with CPR. As per AHA 2015, there are certain steps to perform BLS. Those are circulation, airway, and breathing. Before 2015, we were following airway, breathing, and circulation. Now, as soon as you are about to approach a patient to assess the patient, first thing to check is check for scene safety. Just see whether the scene is safe for you to approach the patient or not. Because until or unless you are not safe, you will not be able to save somebody's life. So please make sure you check for your own safety first before you start assessing the patient. Once you check for safety, then you need to check the response of the patient. So we tap on shoulder and we shout, "Hello sir" or "Hello ma'am." If the patient does not respond, and if you are in a out of hospital setting, you need to activate EMS, that means emergency medical services. Means you have to call for ambulance services. And if you are in a hospital setting, so you need to activate code blue. Then we are going to check the circulation. So we check the carotid pulse for 5 to 10 seconds, and simultaneously we will scan the chest for any normal breathing. If there is no pulse, no breathing, we'll start with the chest compressions. Next, we'll open the airway of the patient by head tilt and chin lift. That is one of the maneuver which we perform to open the airway. After opening the airway, we have to give breaths, 2 breaths. So we perform 30 compressions here. We open the airway and we give 2 breaths. So in short, you can remember the steps by Dr. CAB, DRCAB. A picture presentation to show the hand positioning for the chest compressions. So you should be on the sidewise of the patient, keeping your hands on the center of the chest, on the intermemory line, on the sternum, right? And the hand should be interlocked. It should not be like this, means overlap the hands without interlocking. No, there are chances of the hands might slip, and you will not have the effective chest compressions. So make sure you interlock your hands. The elbows should be straight all the time whenever you perform chest compressions. A small video to show how to perform chest compressions. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. So the hand should be straight all the time. Your upper body should be over the patient, so that your upper body helps you in doing the chest compressions. Now in BLS, we use the pocket mask instead of BVM if you're a single rescuer. Now, how to use a pocket mask? Just watch a small video.
Give two breaths.
So we'll place the mask
Watch for chest
and
rise.
we keep on giving breaths. Make sure you keep looking at the chest for the chest rise so that it confirms that the breaths are being delivered to the patient.
Give two breaths. Give two breaths.
Now, in short, if I'll summarize it, the BLS for adults, we have to perform 30 compression and 2 breaths. That makes 1 cycle. We have to perform 5 cycles, and that should be completed in around 2 minutes. After 2 minutes, what to do? So we'll go for checking the pulse. After every 2 minutes, we have to check pulse if AED is not attached. If pulse is absent, then we'll continue CPR for another 2 minutes. If pulse is present, that means we have achieved ROSC, that is return of spontaneous circulation. So it's a condition when we have a palpable pulse in a patient after resuscitation for a certain duration. So as soon as we achieve ROSC, we'll check for respirations, whether patient is breathing or not. If patient is not breathing, he is having a pulse, but he is not breathing. So we'll keep on giving rescue breaths with a rate of 10 to 12 breaths per minute. And we have to keep on checking pulse after every 2 minutes because patient can again go into cardiac arrest. So while giving rescue breaths, we should check pulse after every 2 minutes to confirm that patient is not in cardiac arrest again. Now, if there are multiple rescuers, so we can go for BVM, that is bag wall mask, or also known as ambu bag. Now, while using a BVM or an ambu bag, please make sure that you should position yourself on the head side because that is the best place from where you can use a BVM. Because we have to perform the EC clamp technique, and that can be performed very well when you are on the head end. Please make sure that while giving breaths with BVM, you look for chest rise every time you give breath because a visible chest rise confirms that the breaths are being delivered to the patient. If you're not getting chest rise, that means the breaths are not being delivered to the patient. You have to reposition the airway or you have to check your device, or might be there might be an obstruction in the airway because of it the breaths are not being delivered to the patient. A quick small video to see how to use a BVM. So make sure you position yourself on the head end. Make a EC clamp technique, C on the mask and E on the mandible, and squeeze the bag half to 1/3. And every time you give breath, make sure you look towards the chest for visible chest rise.
Give two breaths. Give two breaths.
Now, when we say CPR, so we always use the term high quality CPR. Now, there are certain points which comes under high quality CPR, which makes it a high quality CPR. Now, first is push hard and push fast. Now, when we say push hard, that means in case of adults, the chest should be compressed with a depth of 2 to 2.4 inches. In case of children, it will be around 5 centimeters, and in case of infants, it is around 4 centimeters. The parameter for children and infants is 1/3 of anterior posterior diameter of the chest. When we say fast, so for all age groups, it is 100 to 120 compressions per minute. The second point to remember is allow proper chest recoil. Now, when we do chest compressions, now let the chest come back to its normal position so that the heart can get refilled, because if you won't let the chest come back to its normal position, the heart will not get refilled, and next time when you do compressions, there will be inadequate cardiac output. Third point, minimize interruptions. So the interruption should be minimized less than 10 seconds, because more the interruption, the lesser will be the CPP, that is coronary perfusion pressure. If you do good chest compressions, you minimize interruptions, so CPP will be improved very well, and you can achieve ROSC quickly. But if you increase the interruptions more than 10 seconds, then the CPP will be less and very likely to revive the patient, or very likely to achieve ROSC, return of spontaneous circulation. We should also avoid hyperventilation. Now, we should not give excessive breaths to the patient. Two breaths, two normal breaths, like squeeze the bag half to one third. Excessive ventilation can lead to an increased intrathoracic pressure and can affect the cardiac output. So the cardiac outputs will be reduced if we hyperventilate. And apart from that, it can also lead to regurgitation. Because of abdominal distension, patient might aspirate. The last thing that is very important, that we should switch the rescuers after every 2 minutes or after every 5 cycles. Ideally, we should do it after every 2 minutes, but you can do it before as well if any of the rescuer gets tired. Because again, the uh, important thing is to have good effective chest compressions. Now, ideally, we should switch rescuers after every 2 minutes. But if someone feels that I'm tired and I'll not be able to do good chest compression, so they can switch roles before as well. That's all for the BLS for adults. Thank you very much, and please feel free to ask any doubts in the comment section. Thank you.